Okay, I'm here with Professor Jonathan Green of Manchester University, who's of particular interest to us at Transforming Autism because of his research and his work into early intervention in autism, and in particular a study on the PACT method that came out last year and which got a lot of well-deserved media attention. Professor Green, can I ask you, why do you feel that early intervention is important in autism?
Well, autism's a condition that evolves in development, so it's usually emerges and becomes diagnosable around 2 or 3 years, and we know it's usually a lifelong condition, and so it establishes very early in development and it continues, and so it stands to reason that the earlier we can put in interventions that are based on an understanding of how autism develops, it's likely that the better results we'll get and the earlier families will feel orientated, less confused, less perplexed, more able to feel they have a strategy for managing things and to enjoy their lives with their autistic child.
And do you feel that that could make a deeper and more profound and more long-lasting transformation in the lives of the autistic children themselves?
Well, we'd hope so. I mean, I'm a clinical scientist, and so my commitment is to work out the evidence for statements like that.
Yes.
So it would be easy to say yes, it definitely will. What I'm committed to is actually running the studies to show that it does. Mm-hmm. And the PACT intervention that we published last year is a step along that road.
Yeah. And how would you then ascertain the longer term differences? Would it be a case of following the people long term who'd been through the PACT trial, or is there another way that you would assess that?
Well, certainly a long-term follow-up is the first thing to do, and that's what we published last year, which was the follow-up of the PACT children who'd been through the intervention 6 years after the end of the therapy finished, so they were around 10. Mm-hmm. So this was a follow-up into what we call middle childhood. Okay. We're planning to follow up the children again when they're in adolescence to see how it's going. So that's certainly one way, but I think there's more to it than that. So if we think of autism in a developmental context, what I'd be looking for, ideally, what I call developmentally phased and pulsed interventions. So we don't just do an intervention early on, say preschool, or even earlier perhaps, but we continue doing episodes of intervention as the children get older, because their needs will differ. They'll have particular stresses and transition points, etc., and so are their families. And so it's not a question of just doing a one-off intervention. It's a whole program of work through and care through childhood. Of course, it's easy to ask for that, and that's a tough ask for professionals or professional services. So what I'm committed to is working out the most efficient way we can do that. It doesn't mean that families will be in endless therapy. What it means is we do pulses of therapy at strategic moments, and we continue that through childhood and at stress points, and we think that is the way we'll get the best outcomes.
And am I right in thinking that your work is also about almost training the parents so that they can continue to implement ongoing support by themselves as much as possible to their children as they grow?
That's fundamental to the approach. So we work with parents to help their children. In fact, that's solely how we work. We don't work directly with the children at all. In fact. So it's what we call parent-mediated intervention. We bring the parents with us. Almost, it's not really co-therapists, because parents are always parents, but they're parents with added skills, awareness, empowerment to really continue to help their kids 24/7. And I think that is going to be the best and most effective way of transforming developmental lives. Yeah.
For the benefit of people watching, could you maybe give a 1-minute summary of an overview of what the PACT assessment was? Not the assessment itself, but the research that you did.
Yes, well, the intervention, in the way we studied it when we did the PACT trial, lasts for a year. We work with parents using video feedback. So essentially what happens is therapists come to the parents' home or the parents come to a clinic, they watch a videotape of them interacting with their child in a particular circumstance, and they work with the therapist to identify episodes of communication that may be subtle or slightly unusual with their autistic child. And essentially the idea is for them to raise awareness, to realize the child is actually trying to communicate, even though it may be done in unusual ways. And that raising awareness is the first stage. And then we ask the parents to do home practice, so every day a little bit, in that way they embed the new knowledge and awareness into their everyday life with the child. And then the program develops through that into a sequence of strategies to improve social communication, improve language, improve emotional literacy and reciprocity between parents and kids. So that's the program.
Yeah.
It's about 17 sessions over a year.
Okay.
And then what we did was what we call a randomized trial. So we split the families who come to work with us into two groups. One gets it, one group gets it, one group doesn't. Over 150 children or families in the whole trial. So roughly half and half either got it or didn't. And then we follow them through as they go through the intervention and then afterwards to compare the difference.
Yeah.
The idea of a trial like that is it's the best test of whether the intervention is really helping,
Yes.
because you're making that comparison between getting it or not. And we followed them through, as I said before, to 6 years after the end of treatment. And then we did an assessment again and saw how the kids were doing.
And can you say a little about the results?
Yeah, sure. So what we found was very striking. So we were particularly interested in autism symptoms and measuring autism symptoms. The reason for that is they're the defining behaviours of the condition. We think if you really want to treat autism, that's what you should be targeting. Other people do different things, but we think that's the logical thing. You know, if you've got a treatment for diabetes, you look at blood sugar. You don't look at you look at other stuff too, but it's diabetes related. We think autism related behaviours are the things we ought to be looking at. But we also look at parent-child communication and other adaptive things. We have teachers saying how they're doing in schools, parents commenting how they're doing at home, etc. So we have all those measures, and what we basically found was that at the end of the intervention, the symptom severity had reduced significantly, and that reduction in the severity of the symptoms continued right through to 6-year follow-up, which is very striking, never been shown before. Very unusual for any treatment actually to show such a long-term effect. The parents' report, and that was done by researchers, so they were blind, what we call blind to whether the family had the treatment or not. So it gives them the most objective view. But we also asked for parents for their views on how the kid is. And when we looked at that, the parents also said that if they'd been through the therapy, their kid was doing better. So did the teachers, although that wasn't such a big effect, but the teachers, there was a tendency for the teachers to say the same thing. So essentially in all our measures as we went through, the kids were doing better 6 years after the end of treatment into middle childhood, which was very striking and very pleasing for us. And it's the first time really a long-term follow-up like that's been done, so it's very encouraging for the field, I think.
And that was what was interesting to us about the study as well, because we're very interested in early intervention, and it was the first clinical trials that we'd ever come across that actually demonstrated that intervening early in autism with the right sort of approach can lead to permanent lifelong effects.
Yeah, and lifelong certainly, and through to middle childhood in our study, and as I say, we're going to follow them through and see if those effects continue. But because they seem so sustained, I would have a bit of a hunch, a bit of a bet that we will still see the results in adolescence.
Yes. And there's a lot of anecdotal evidence from other early intervention therapies from parents as well that things are long-term, but this is the first clinical trial.
Well, that's true. So there's been, of course, in the autism field, lots of anecdotal reports of wonderful therapies that have made a huge difference. Sometimes that's going to be absolutely spot on. Sometimes it's just, the bias of hope.
Yeah.
We all, And really, I'm committed to the view a clinical trial is the best way of really showing this and getting solid evidence. So, absolutely. But of course, people have been advocating therapies of different kinds and reporting good effects. So yeah, I mean, let's be hopeful. Let's not be unrealistic. Our children in our sample were all children with severe autism, actually. So they weren't so-called mild. They all had core autism. And, almost all of them still had autism. It's not that this isn't a miracle cure, it makes it all go away, which you sometimes hear. It's usually totally unrealistic. But the level of symptom severity was substantially decreased. And I think that's a realistic thing that parents want to know. They don't want, snake oil miracle claims. They want to know what's kind of realistic and to expect for you.
So while we're waiting for the results of this research to seep into the mainstream care available, and we hope to be part of that process as well of making that happen, what do you think are the changes? Can you think of any changes that could be made at the moment in the current context that would be of support towards young children with autism?
Well, I'm a doctor. I work in the NHS. I work and I'm committed to, developing the health service to be responsive to developmental conditions like autism. So that would be my perspective, that we have to improve NHS provision. And there have been kind of fits and starts, progress and then things going back. I would say at the moment things are going back a bit, which is really disappointing. But we do have mechanisms within the medical community for disseminating good evidence-based research, and that should make a difference to practice. So just a couple of examples, 2 or 3 examples. We have the so-called NICE committee, which is a government committee that recommends good evidence-based practice. I would expect when they next report, they already reported in 2013, at the update report, then I think PACT will be nominated. It was recommended last time, but it will be strengthened this time.
Okay.
And that should have a big impact. There's one other therapy from America that also is mentioned by NICE that also has some evidence. So it's not, PACT isn't the only thing that's got some evidence behind it. And then we have other mechanisms within child mental health and developmental services that will disseminate good practice. So, and I'm working towards that in my kind of committee work. So, amongst others. So, I hope that we can improve awareness. And what I'd like to see is that practitioners deliver practice that's known to work, because what we know from other areas of medicine is that that's more efficient. If we've got a health service that's shrinking, which we have, we've got to really be tough on what works and what doesn't. So that's what I'd be hoping for, and earlier. So, and then you have to have the screening and diagnosis services, and again, there is a NICE committee on that's meeting at the moment. So there's really a lot of good information and good awareness and good professionals out there. What's actually missing at the moment is health resourcing, just to allow it to, deliver the service to families. And so it's a money thing, and the advocacy community is very strong in autism, and let's hope that they can make a difference.
Okay, thank you. Final question.
Yeah.
What one thing would you recommend to people who are parents and carers of autistic children to put into practice to improve their lives?
Wow, that's a
big one.
That's a big one. One thing, I think. Firstly, parents should trust themselves. So parents have intuitive knowledge. Parenting is an intuitive process. And one of the things parents feel often when they have a child with autism is a sense of de-skilling. Their normal kind of intuitive skills and knowledge just don't seem to work. And a lot of parents I talk to, is actually how we got into this form of therapy in the first place many years ago, is a lot of parents feel de-skilled, disorientated, often profoundly upset by the situation, not knowing where to turn. And so I think the message would be trust yourself. Actually, you're a good parent. Most parents are fantastic, incredibly committed to their kids. What you need is the skills and the tools to allow you to be the best parent you can be in this particular situation with this child. And that's what our therapy hopes to achieve for parents. And so trust yourself as parents, and search out some good, reputable knowledge resources to get good evidence-based care, because the evidence really does make a difference. I think you know, if we have evidence-based practice, it's been through a lot of development and testing, and that means it's more robust. So,
Professor Green, thank you very much.
okay.